Hi everyone. So I'm Donna, I'm a midwife. We're over at the Midwives Australia stand if you want to come and say hello. I'm here today to talk about hairstyles for the next season and makeup techniques. That's what you were here for? No, damn, got it wrong, no. So it's newborn care, and I thought that seeing most of you are men or still pregnant, that I would talk about the first 6 weeks predominantly, because as you can see from our last speaker, there's a lot of theories and decisions and choices that you can make about newborn care, and so I'm trying to be unpolitical and just go to the facts. So I've got Bertha here. So most babies don't come out this big, so don't worry. That would be exceptional. I actually did have a baby recently that was 5 kilos. I was like, oh my God. Didn't fit, surprise, surprise. But yes, this would be a nice, 2-month-old child, well-fed, breastfed. So with no formula, top-ups. So I'll leave that one alone. So obviously it's a new challenge for any new parent. You have this little baby, you want to do the right thing, the best thing. You don't want to cause any harm or do anything wrong. And as any new parent would explain to you, that generally if you think about it, you really don't do the wrong thing. You might do something that doesn't work, and you think, well, I might adjust it and learn from that and, do it a slightly different way. But you've got to think through the processes. So this little baby, Bertha, wouldn't fit in, but remembering that babies sit inside your tummy upside down generally, which is the right way. And so in this environment, they've got a tight uterus the whole time. So they're cocooned, they can't starfish, they can't flap themselves on the head. So a baby when they're born likes to be cocooned, to feel like that. So that's why we talk about wrapping all the time in hospital, and you'll go home and the midwives will say you need to wrap the baby, and you're like, well, is there any other option? And it's really to remember the environment that the baby's come from. So initially it's been in your uterus, it's been cocooned, it's listened to your heartbeat the whole time. So it's listened to this heartbeat its whole life, and it's had motion. So to get that baby to sleep again, we need to mimic that environment. So we need to cocoon it. So I'll just demonstrate a wrapping technique, and if you want any more information, SIDS and Kids have got lots of info. I see at our Expo we've got lots of companies that have come with their products. So remembering, it's like anything that you see here is outsourcing something basic. So we can do wrapping like I'm going to show you, or you can get a zip-up swaddle, which is outsourcing the wrapping because you add a zip, which some clever person came up with. So it doesn't, you need to use that kind of mindset when you look at the different products around today, not meaning that your baby's going to sleep for 10 hours a night if you get the zip-up swaddle versus if you're really good at wrapping. So, you've done antenatal classes, haven't you? No, not yet. Well, you've had babies. Come up here. You smiled. She looked interactive. Yes. All right, so Bertha here needs to be wrapped. So can you remember how to wrap?
We didn't wrap him today.
Oh, you put them on their tummies, which we don't do anymore. And look, she's still alive. No, we'll leave that one alone. Oh. So Bertha here needs to be wrapped. So you bring the wrap across her body and you kind of roll her on her side a bit and tuck her under the weight of her body. Perfect, and it goes underneath. So in effect, her body weight is holding the wrap in place. And then you do the same thing with the other side, and then you tuck the wrap under her body. So really, when you think about the outsourced zip or using the body to hold the wrap in place, when you're in hospital, they'll tuck the bottoms up. I'll just put the mic down. So like that, so that you kind of bring the baby's knees up to make them feel even more cocooned. But when you come home, you need to stop doing that and let the wrap fall or tuck under the mattress, because it's important for the baby to start to stretch their legs out and feel the bottom of the bed. Thank you. And that's often something that you forget. So if you can lock that one away in the back of your mind, so you remember when the baby's 7 or 8 days old, right, we're going to stop hoiking their legs up, because it's quite important for their hip joints that they start to stretch out and not always sleep with their knees up. So you can imagine that a little baby that's wrapped up feels safe, because they came into this world and they don't understand it. They just think, what the hell's going on? I'm breathing, there's no boundaries, where's the heartbeat, and feeling nice and safe and secure. So as the baby gets older and it has more development changes and its brain starts to really evolve, because remember the first 6 weeks, in reality, the baby has 2 major development changes, because they're born and their brain isn't mature yet. If they waited until they were mature, they would never fit out. So they're born immature. And so that's why babies that first come out don't really smile and interact, and really are very, very dependent for everything, feeding and weeing and pooing and everything. So in terms of safe sleeping and understanding how to get this baby to sleep, keeping to those simple principles of boundaries, motion and heartbeats tends to work most of the time. They do, they have skin that sheds off, they have a bowel that's not mature that they have to get used to processing full milk. So there's lots and lots of changes. Obviously, advice and support for sleep and settling problems. Normally in that first 6 weeks, you might be going back to the hospital, you might be having child and youth health come out, you might have a private midwife that comes out and sees you at home, which is a service that I provide. And knowing that, you need to try and get that consistent advice, because remembering that there's no right answer. So if you keep seeing different people all the time, you keep getting really conflicting advice, and then you get confused, and then you lose confidence, and then you think, oh, it's too hard. But there is support services out there, and knowing, the best thing that suits you. And sometimes you have to do a little bit more research. So sleep and settling, I could talk about for the rest of today. So I'll skip through to common skin, and again, there's lots of products here at the Expo about skin and washing and cleansing, and remembering that babies are born with quite immature skin. They actually shed a complete layer of skin in that first 2 weeks. And so when you're looking at products, whether it's nappy rash or moisturisers or soaps, we always say to know the baby's come from a sterile environment. It's never had chemicals touch it. It's been really protected. So thinking about what you're putting on the skin, if it smells really good, it's probably full of oils or chemicals. And leave that until the baby's just a little bit older and their skin's a little bit more mature. So, whether you go for a pH neutral, like your QV brands, or just Swaddling, or something without lots of added chemicals and fragrance. So if it smells good, don't use it straight away, because this baby's skin's really fresh. Like, they look really unattractive at 6 weeks. They have pimples and dry, crunchy ears, and it's really gives you some insight into how pure they are when they're born. Like, this is a major reaction that they have to the environment that we live in. Even you think of your fly spray thingos and your fragrance things, like those kind of chemicals are just floating in our air all the time, let alone directly applying a really fragrant, oil-rich cream to their skin. So know that, there's lots of skin changes, lots of skin flicking off, and rashes and pimples and spots. Nappy rash is also one of my favourite topics. And, we buy the pseudo cream. I'm sure you all got one in your bag. And bepanthen, and everyone's like, well, what's the best one? And take marketing aside, if you think about the product, so the product's providing a barrier cream on the skin so the poo doesn't sit against the baby's skin, because poo's acidic. So if we always apply a barrier cream just in case they do a poo, then the skin never gets a chance to breathe. And so in doing that, we can actually cause a rash or cause the skin to break down. So I always say, if the skin looks good, maybe add some more moisture. So something like a pawpaw cream or a Swaddling cream. rather than adding a barrier cream just in case. And if it is getting sore and breaking down, then you might look at taking away chemicals with wipes, and alternating with the barrier cream and some moisture. Because if you think about it, if you've got a big rash and you put a cream on to stop the rash getting worse, but you never add moisture, then the rash actually keeps getting worse because your skin needs moisture. So, just have a look at what you've got and what's around, and know that there's no 100% fixer. You've got to use a bit of logic and think what the skin needs rather than what you should do to fix it. Breastfeeding, I could also talk about all day. And really, a lot of hospitals and the ABA have really good breastfeeding education classes. There's some quite good content on the internet about positioning and attachment and the benefits of breastfeeding we all know about. I guess, has anyone got any burning questions on feeding, or how long or how often, or where to get more information if you want it? No, you're all good. So I think the ABA has got a stand. Maybe. They did last year. I haven't had a chance to look around yet. But they're also a really good, really, really good website if you want to have, they've got lots of information on different topics. So if you're up at 2 o'clock in the morning, you've got a blocked duct and you're thinking, oh my God, what's going to happen? Is my boob going to blast off? Because it'll feel like that. Google ABA and you can just look it up, and it's really about reassuring yourself that that's quite normal and how to clear it through rather than letting it turn into a roaring mastitis and stuff like that. Blasting off boobs, you're thinking, oh my God, could that happen? No, it couldn't, don't worry, they don't fall off. And to be confident with the normal changes that your body does, and that we are humans and we should make our own milk rather than a formula which is made for cows. It's a cow-based, that's how it's made. And so, us midwives are all very, just having a look to see who's standing around, are very passionate about breastfeeding and supporting that babies are much better fully breastfed rather than adding top-ups and extra bits and pieces. But I will stop. Was there any newborn related questions at all, that anyone's looked at something and thought, oh, do we need that, or no? Excellent. Well, it is lunchtime. And so I'm sure you've all had a very fun Expo experience today. If you've got a question that you'd just like us to answer personally, there's a few of us midwives over on the Midwives Australia stand, so we'd be happy to answer any questions. But have fun.